Hi, I'm Dr. Jim Carlson from the Grove Animal Hospital and Holistic Center, and we're going to talk about a 9-year-old cat that I saw recently. And she presented with for routine physical examination, but was experiencing a decrease in appetite and reduced litter box habits. And so we talked about running a custom holistic testing to determine the root cause of the problem. And so as we come over to see the test results, the base point readings, we're looking at 30 different points, and we can see that most of these are green, indicating balance. But if we come down to less than 47, we get into weakened area or more chronic problems. And so this was the skin. And then we come down to the stress side, which is above 55. And we see that there's 3 items down here. TW3 is the pituitary and pineal, which is a sensory circuit. TW1B is the hormone circuit of the whole endocrine system. And then number 3, we have the urinary bladder, which is indicated at 56 over here as stress. So when these 4 parameters are off, it can cause problems related to digestive tract, in which this case during a physical exam we did hear a heart murmur and also what they call foral lesions, which are feline oral resorptive lesions, which are cat cavities. And the stress that's going on inside the GI tract right now is triggering some of the autoimmune conditions that we see with the foral lesions, and also the problem with defecation and going to the litter box has some issues with the urinary bladder down here, because that's the lower part of the body. So when that's affected, we're going to see problems with the litter box potentially as well. Also stress can trigger these things. So indirectly, we see where there can be some problems. So first of all, we're going to balance these points for 3 months. We're going to use an infusion oil, 3 drops a day, and we're going to use this for 3 months. And the recommendation is, because until we balance these, we're not going to see total health recovery. So in 3 months, we'll retest and make sure that those numbers look good. There was also a sensitivity report, which looks at what our patients are either allergic or sensitive to. If we come back to the original test, we see that we're not allergic to anything. Allergies here, and also a little further down, allergies here. But we are sensitive to a few things, so if we go back to that, we can see that, first of all, we break these sections down into groups, and then certain environmentals, skin. We see that there was a number of these that are okay, and then we get down to environmental inhalants here. Cacti and succulents, or the broadleaf plants that we have in the household. Doesn't mean that we're exposed to these directly, but if there are plants in the house that do fit that description, then it's possible that this kitty can have issues with sensitivities. Also coming down a little further, we see that we get into some of the food groups, fruit, dairy, and also cooking condiments are usually picnic items, things like that. And so not every patient that's exposed to these things would necessarily show symptoms, but also it doesn't necessarily mean that they've been exposed to these products as well. So if we get down to the dairy area, certainly egg and egg yolk, and then cheese. Cat foods can carry egg, and certain cat foods can have cheese in it, or certain supplements. So we'd want to check the diet and make sure that we're not, that none of these items are on the food list that this cat is getting. Also, fruit, and we don't see cats eating a lot of fruit, but at the same time, they can be included in cat food diets. Pineapple is probably not, orange probably not, but we can see apple and blueberry in certain cat foods which we're sensitive to. Grapes, most cats don't get grapes. Dogs can be more susceptible to to grape sensitivity. And so not a lot of these we would see in cat food, but we would want to review that list and make sure we're not being exposed to that. And then finally, the condiments, usually pickles, Miracle Whip were two of the things on the list, but this would be indirect exposure, but this would not necessarily be included in cat foods. Cats, I suppose, if we were cooking with Miracle Whip and dropped a little bit on the floor, the kitty could lick that and be sensitive to that. But most of these we're probably not going to see direct contact with. So those were interesting. But to finalize the treatment summary, first of all, what we're going to do is we're going to use an infusion oil to balance the points. And number two, we're going to use an immune system booster to help with the cat cavities and also to improve intestinal health and get the litter box habits improving. And then finally, we're going to add some healthy powder to the diet to balance the diet without changing the food, because we didn't see any changes needed to the whole diet. But if we supplement the diet with the healthy powder, then we're going to balance that out as well. So each month we want to chart progress until 3 months. I would like to see this patient back in my office to do a physical examination. And then in the meantime, we chart progress. If there's any symptoms, we definitely want to address those as we go along. Thank you so much.